There are 4 steps you need to take before starting exercise. Step 1, get medical clearance to make sure exercise is safe for you. Be sure to follow all your surgeon's guidelines. The next step is to do a self-assessment. Why? It can be difficult to realise that you're making progress with your exercise. So if you have an assessment, you can measure yourself at various points in time to see the gains that you are making. An example, I had a patient recently tell me they hadn't improved at all in a couple of months. But upon further questioning, this person told me 2 months ago they had to use the handrail to climb the stairs, and now they can carry their shopping up the stairs without holding on. They'd taken for granted this progress that they made. So your self-assessment can firstly comprise an exercise diary. Look, if you're doing nothing at the moment, that's okay. We're just here to set a baseline. So you can write down what you're doing and also how much your pain is out of 10 and how much your fatigue is out of 10. Again, this can help you monitor progress down the track. You can also put down what we call a functional assessment. So you can nominate something that you're struggling with. For example, it might be cooking. You're struggling to cook because you're so fatigued. So you can rate from 0 to 10 how much difficulty you are having doing this. 10 out of 10 would be easy as pie, no problems at all. 0 is I cannot do it. And you can rate that out of 10. So for example, you might say your ability to cook dinner is 5 out of 10. And it's because, you can do it, but it's absolutely exhausting and you have to go and have a lie down afterwards. You can also do some simple exercise tests on yourself. In a future video, I will describe a 30-second sit-to-stand test and a 1-minute sit-to-stand test. Make sure you keep this in your exercise diary. Write down how many you did, whether you had pain or fatigue with it, and rate that out of 10. You can make up your own tests. So for example, if you have stairs inside your house, you might time how long it takes you to climb from the bottom step to the top step and write down whether you had to hold onto the rail and whether you had any pain. You might have somewhere you like to walk. For example, I have a short walk to the local shops. So you could decide to time how long it takes you to walk from home to the local shop and use this as an assessment tool in the future. The third step is to get some exercise equipment. If you don't have any money, there are options for making your own weights. A kitchen chair is a great piece of exercise equipment. If you don't have weights, you can make your own. You can put grocery items in a bag and use that. You can use water bottles. You can fill them with either water, rocks, or sand. My preference is for you to have a dumbbell that is adjustable. I have Spinlock where we can slide different weights on and off. I'm not going to lie, it is a little bit time consuming by the time you... If I had my time again, I would buy power blocks, which are much quicker to adjust. Another option is exercise bands or resistance bands. I recommend the ones that come in a kit with handles and different strengths. This way you can progress your exercise. This one comes with a roller that you can pop in to the door. You don't want to be tying knots on things. Resistance bands have their place, but my preference is for adjustable dumbbells because you can more accurately measure your progress and you can more accurately progress your exercises. The fourth and final step in your preparation is going and viewing the videos I have made about exercise and pain and exercise and fatigue. Okay, if you're at risk of lymphedema, please go check out my videos. Understanding the lymphatic system, learning how to self-assess to see whether you may have early signs of lymphedema, what to do if you have lymphedema. Time to do your homework. I'll see you in the next video.